Hey to all those seeking vibrant health, it's Dr. Rachel Northern here and another one of my monthly talks. Today we're talking about pain, and obviously as a chiropractor we deal a lot with pain, people coming in pain. So the pain game, sports and repetitive injuries, how, and how to prevent, how to treat. We're going to gloss over a couple of these things, so hopefully these are helpful tips for you guys. And so we're going to start out, what is pain about? So pain is really relative. I have some people that come in and they're like thinking they're dying, and I barely can barely touch them, and they're off the table, and like it's and they barely have anything off. And I have some people, I could be like putting my elbow in their back and they're like, oh, it feels a little tight, and they are severely off and are subluxated. So it's really, everybody's wired a little differently, and that's okay. Accept who you are and your stage. Also, pain is relative as far as like if you're not feeling good, like if you're emotionally had a lot of stress, your pain is going to be amplified. Any type of physical pain is going to be amplified in times of depression, times of anxiety. All these other emotions can factor into that. Also, we talk about diet and how that affects your body. So all these things are relative, but the main thing I talk to patients is pain means pay attention. So unfortunately, our society is about pleasure and all about pleasure, and we shouldn't have any pain, but pain is a learning lesson. Pain needs pay attention. One of my mentors said this years ago, one of my first seminars I went to when I was like out of chiropractic college, and it was like kind of eye-opening, like pay attention, because even in good things in life, childbirth, that's pay attention. You're bringing a new life into this world, and so that's something to pay attention. You break your arm, you want to pay attention to that. You want to guard it and let the body heal. So if we're dumbing down whatever way we can through meds, other ways, when the body is trying to help you heal, that's not good. So you want to pay attention. Pain is important. And then as a chiropractor and a holistic practitioner, we want to say why. Why, if you do have pain, what's the source of the pain? Let's go to the source and fix the source versus covering it up, just band-aiding it, taking a drug to shut the pain signal off. I have a lot of patients that come in and they're like, is it okay to take over-the-counter pain relievers or whatever? And sometimes, okay, it's fine just so you can get some sleep or rest or get you out of crisis, but that's not something you should be taking all the time. And actually, over-the-counter pain relievers say if you're taking them over a couple of weeks, you're supposed to contact a healthcare physician, because they know that's not good for your kidneys, liver, pancreas, all your body organs. It's not very good to take that long term. So even if it's over the counter, does not mean it's safe to take all the time. And so that's one thing I always like to try to get people off any pain medications if we can. So the body is wise. So just remember that. The body is wise. The body is always trying to tell us something. It wants to be healthy. So whether we pay attention or not, that's up to you. So our society's stuck in this cycle of pain traps. So you take a medication, it blocks the pain, it blocks the tissue healing and recovery. And then it causes like prolonged inflammation, which actually causes more long-term and chronic problems because we're not addressing it. So I have a lot of people that are doing repetitive things at work, and maybe they're taking it over the counter, and that doesn't stop them from injuring their shoulder or whatever they're doing worse, or low back. I have a lot of like my construction workers that they just keep taking something, they keep lifting, and the next thing you know, they have a herniated disc and they have to go to surgery because they were ignoring the little signals saying, hey, something needs to be addressed. If they could have came in, one of us, holistic practitioners, we could have maybe addressed that before it became a serious problem. So trying to address that, if you don't address it in the beginning, it becomes chronic, and then it becomes harder to reverse. So, and then you become dependent and taking it all the time. So you don't want to get stuck on this cycle. We try to enter in here in the beginning, and there's tons of research now we have on chiropractic, holistic practitioners, physical therapy, acupuncture, actually helping with low back pain, headache, any of the physical pains, that we can catch it before you become dependent on some of maybe these big core medications like opioids, which we have a really problem with opioids, and that leads to addiction in the brain, and then people are dependent on it. So it's a serious problem, and we can nip that in the bud if we just address the problems in the beginning, the origination of the problem. So some of the holistic ways we can treat, like I just said, I talked about chiropractic. Obviously, we address the body, see where it's out, and then correct it and get it back body where it's supposed to be. It's a great thing. I love what I do, and it works really well. And some other things about that is chronic bad posture. Trying to correct that. I am all the time trying to see why patients are maybe subluxating. And sometimes I have people that are working from home and they're working from their recliner or their couch and they're bent over a laptop. And I'm like, right there, you're causing problems on yourself. Let's get you a proper workstation at home. If you can get a sit-stand desk, what ways can we adjust that? If you're in sports, are you doing things properly? Are you going to the gym? Are you lifting properly? I go to the gym, when I do go to the gym, I work out at home most of the time, but when I do go to the gym, I'll see at least one person lifting improperly or doing something improperly, and that's just not good. So if you do join a gym, they usually have someone that can show you intro of how to do things properly so that you don't hurt yourself whatever ways you're working out. So proper posture, ergonomics, like I just talked about, chiropractic, things that you can do alternative to like over-the-counter pain reliever is Boswellia. Serrata is a good anti-inflammatory. That's frankincense is a common name. So you can actually put that topically on and help with inflammation that way. Turmeric is a great also just long-term for chronic to help calm the body and the inflammation down on some patients. Icing when you have an acute injury, but also I have a lot of people with the shoulder where they're doing repetitive things and they have a tendonitis, and I'm like, just ice every night for like 5 to 10 minutes, and maybe you do that consistently over the course of the week, and they'll calm that joint down and help it maybe recover, and then make sure we reverse any of the bad posture activities they're doing as well. Omega-3s in your diet also are really important. We know as a society we are not getting enough omega-3s. It's supposed to be for like, I think omega-3 to omega-6 ratio is supposed to be like 1 to 6 or like 1 to 27 or 26 or something like that. So we're not getting enough omega-3s in our body. We need tons more omega-3s. And those are those natural anti-inflammatories. They're good for the heart. They're good for the brain. So if you don't know what omega-3 is that new phrase to you? That is fish oil and flaxseed are some of the ways you can get omega-3s. Also, walnuts are rich in omega-3s as well. So try to incorporate those into your diet as much as possible. I generally tell people to try to get at least 2,000 milligrams of omega-3s in daily. So tips for prevention. So first off, variety and getting different, variety of exercises, variety of sports. Unfortunately, we're in a society now, we find a kid that's really good at softball and we have them playing softball all year round now, or volleyball, and they're playing volleyball all year round now. Now, when I was a kid, we had the seasonal, a boy would be going from football to wrestling to baseball, and then maybe they did a couple different things over the summer, swam and did different things and then started over again. They got a variety of different activities in their body. Now they are doing football like camps all year round. They're doing like right now, we used to just have maybe a couple weeks before school started, they started football camp. Now it's as soon as they're done with school, they're already doing football camp. And it's just crazy to me that these sports are doing that. And I'm already seeing a lot of kids already with repetitive injuries, kids having to do physical therapy or surgeries for their knees and their shoulders. So they need to mix that up. They need to find a way to get some variety into their lives on exercise. So I'm working on their core too. I have a lot of the kids I'm talking about doing planks and doing other things to make sure they're strengthening their core. So mixing it up. So you yourself as an adult, if you're not into sports, I try to mix it up with my exercise. Sometimes I'll hire a trainer for like a couple months to just mix up my routine because I get in the habits of the favorite ones we like to do, and then we ourselves are causing the repetitive. So it's good to try to get variety in. Like right now it's summertime. One of my patients actually does water aerobics in her backyard, so I join that. I mix it up with that during the summer. I just got a rebounder for Christmas last year. So I'm mixing it up and trying to always add different things into my routine. And then I always try to do some yoga and stretching, which we're going to talk about in a minute here. So balance, that's one thing we have lacking. One of my things when I do my history and exam, I actually am texting people on balance, and I am so surprised at how many people can't stand on just one leg and hold it there for like 30 seconds and switch the side. They'll have one side that's weaker, and they're very surprised about that. And it's not just seniors. Usually it's common in seniors, and I'm always giving them the exercise to practice balancing on one leg to prevent them from tripping and falling. But now we're getting it in younger and younger ages where they can't stand on one leg. So balance, working on balance. Working on, that's yoga can do that. Tai Chi has been a great thing to do, incorporate. You can get videos on that. There's all these apps nowadays. If you want to go in a group, I'm sure there's somewhere in your local, at least within 20 minutes, that you probably can drive to find somebody that does that. Like I said, rebounding. Martial arts, that's been becoming really popular again, and just doing martial arts of some sort. They're really important about doing your core and finding your strength in different ways. And then one thing, a caveat about this too, is about exercises. I just really don't recommend traditional sit-ups. I've had a lot of people that hurt their necks when they're doing that. Nowadays, our society, because we're so forward in tech neck, that we're so weak back here that it causes a lot of strain on the neck when they try to do traditional sit-ups. And there was research, I think about 10 years ago, that said that actually they're not really that great for the body anyway. So try to find alternative ways to do your core. You can do leg lowering. There's all kinds of other ways to activate the ab muscles without aggravating your neck and shoulders. So I don't really advise that. So tips for prevention, trying to always do a couple minutes of warm up. I generally start slow on my treadmill or walk. Before I do that, they talk about dynamic stretching in the beginning where you're moving your muscles, and then do more like those yoga holding stretching at the end. And there is tons of research showing that is really beneficial for your muscles and your tendons with your workouts. Or if you're just you're going to go have to go to the city to visit some fun stuff you're going to do, and you're going to be walking a lot, do a little warm up that morning just to make sure you're ready for it if you're not used to walking a lot. Any way you can to prepare your body for something. So before, after activity, I like my post exercise routine is sun salutations. So we can send you that video if you want to message us or whatever. I did record that a couple weeks ago, like my version of sun salutations, which is a series of different yoga moves that kind of stretch the whole body. So that is what I kind of go through to make sure I get my body all stretched out at the end of my workouts. So that's a good one for a tip there. And then other things to help you not get injured. So first off, invest in shoes. Okay, the cheapy, whatever, $20, $30 shoes, gym shoes or whatever. Yes, they'll probably only last you a month or two if you're actually seriously working out. I want to make sure you have an arch support, and also pay attention. A lot of times the top of your shoes look fine. Flip your shoe over and look and see if you have the bottoms, if you see like an edge worn on the inside or the outside, if you have actually tread left on the shoes. I was just talking to my office manager, talking about how at least once a week I'm lecturing somebody about these shoes need to go in the garbage. These are no good. They're not supportive anymore. And even my husband, who's in construction, he knows his back will hurt once his shoes are starting to wear out. So we always have an extra pair of shoes in the hopper when he's ready to retire his shoes. So like very much, that's one article of clothing I tell people to invest in is your shoes. I myself try to turn over my shoes every 6 months. My professional shoes here I wear in the office, and my gym shoes I work out with. So I go to the shoe store, like twice a year, and try to just ditch the old ones, even though they look really good, because I know inside and how much miles I put on my shoes. So pay attention to that. There is charities too. You can donate your shoes too. So if that's something that you want to do, that'll help your heart. The second thing is go at your pace. So I have some people that get into these exercise classes, or even if they're watching a video and they hurt themselves because they're trying to do things that their bodies are not ready to do. So if you're in any really good class or even a video, they'll try to say, do your own if it hurts you or you're not feeling like it's good for you, stop. Do something else. Do something like jogging in place or a light activity until you can go on to the next thing, or wait till you need to calm down with your heart rate, whatever you need to do, but you need to listen to yourself. I've been to a lot of yoga classes, and usually the instructor says, if you can't do this stretch, it's okay. Honor your body, honor yourself. And that's how it should be. You need to listen to your body when you work out. First off, if you're working out in the first place, I'm happy. I'm excited as a doctor. You're doing something for yourself, but you don't have to go at the same pace as everybody else. So you and you're unique in your own stuff, and make sure that you're doing what you are supposed to do, and don't worry about anybody else. Comparison game. And then eat healthy. So again, every video I probably talk about low carb Mediterranean diet. It's one of the best diets, anti-inflammatory. It's got the omega-3s and fruits and vegetables. There's been a trend about plant-based eating. As much as fruits and vegetables you can get into your diet in a day, that's going to help you. Eating those colors. Those are things, antioxidants, that help your body heal. All the nutrients you need to restore those things. So one particular nutrient I focus on to people who exercise a lot, or my athletes that come in, is manganese. Not magnesium, but manganese. Manganese is a mineral we need for our tendons and our ligaments. It gives our ligaments and tendons their tensile strength, which means it makes them the strongness of them. So we want to make sure we put those nutrients in our body so the body can strengthen those areas and be strong. So those are in nuts and seeds and veggies, the dark green leafies, and those are really good there. So we also have supplements that we offer here to help those. So anytime anybody just injures those, I usually put people on supplements to help them heal faster. And it's funny because when we put them on the supplements, a lot of times that does make the pain go away too, because the body's got what it needs to repair. So, and then just, overall doing these activities, longevity is connected to flexibility, agility, and endurance. So we have all these in mobility. So there's tons of research correlating with the better you do with all these things, making sure you're flexible and keeping active, you're going to live longer, is what they say. So, this right here is part of the fountain of youth that you're looking for, is doing these things and decreasing your pain level as you get older. You're going to have some issues, but if you work on these things, it'll help. And that's all I have on my topics today. If you want any more information, I have a ton of videos on my YouTube channel. I believe it's up here. It's Rachel Northern DC CCP. So that's my pediatric and pregnancy certification I got many years ago. And thedoctorandyou.com is my website. If you have any interest, you can always message us through there. If you want to text our office, if you have any questions, 815-344-0113. And thanks for joining us.